Here in Colorado, more than 1,800,000 people have gotten at least one dose of a vaccine so far. That's nearly a third of our state's entire population. Nationally, the CDC now says just above 18% of the population has been fully vaccinated. That's more than 61 million Americans. But months into the rollout, some people still not sure if the vaccines are safe. Well, here's CBS 4's Sean Chitnis. Sean, an expert who helped test one of the vaccines, tells you the public should be confident.
Jim, that's right. Here at UC Health, he tells us that was the plan all along, for it to be made as quickly as possible. And he certainly understands why even today people are still a little unsure about that. But Dr. Thomas Campbell, who is the Chief Clinical Research Officer here at UC Health, says there are 4 different factors unique to COVID-19, as well as the response that has made the vaccine so safe and effective. 3 different vaccines using different technology. Pfizer and Moderna developed with a newer approach called mRNA, technology in the works since the 1990s.
These are the first vaccines to come out, be implemented, and to be rolled out using the mRNA technology. I would predict that they won't be the last.
Johnson & Johnson uses the viral vector approach, an older technology. Another reason why the vaccines got developed so quickly, all the trials had plenty of volunteers.
There was just overwhelming community support for these trials.
And the virus spread fast last year, right as the trials were underway.
The fact that there was so much COVID going on in this country, that allowed the trials to get the data that they needed.
While we often refer to COVID-19 as the coronavirus, it's just one of many. SARS-CoV-2 is the one we're fighting now, but the first SARS-CoV was an outbreak in the early 2000s. Another coronavirus, MERS, happened about a decade later.
A lot of the technology that went into making these vaccines for SARS-CoV-2 successful was learned from those 2 other coronaviruses.
A unique combination of factors leading to an innovative way to protect the public.
We should all be very proud and thankful that we were able to do what we set out to do.
And Dr. Campbell says he's also aware of the concerns about effectiveness for people of color when it comes to the vaccine. He wants to point out that of the about 100,000 people who participated in different trials for all 3 vaccines, more than a third, were Latino volunteers, and about 15,000 were Black. And so far, the vaccine is showing that it is effective for people of all backgrounds. Reporting live tonight in Aurora, Sean Chitnis, covering Colorado First.